Dr. Yasmin Ali Haq, country representative of UNICEF India, joins us. Ma'am, there are so many obvious and also hidden ways in which children have been affected by the pandemic. Tell us just how badly they have been hit. Why we need this campaign to reimagine a different tomorrow for them.
So thank you so much. Let me start by thanking you for joining us in this campaign. As we celebrated World Children's Day, it was a stark reminder for us that we have to address the crisis as a child rights crisis. We know that around 11% of the cases are of people under the age of 20. And children are directly affected, but the face is really one of an adult one. However, for us, it's really important that we see this, how child rights have been affected. Consider children whose parents have lost their livelihood, who have had to move from where they live to another place of shelter. Consider the 300 million odd children who are not in school at the moment. And not all of them, in fact, a very small minority of them are able to access online learning. Plus, as you were saying, the basic services that they did not have access to, the fear and stigma that is affecting them and their families. So for all these reasons, it's so important for us to bring the attention to children, because what affects them today can have a ripple effect for much longer. The type of psychological harm that children are facing. As you said, Childline has had more calls. So children are really being impacted by it, and it is in a way silent. And thank you for joining us and making this apparent. We have been working with the government, with civil society organizations to bring focus on the services that are needed. And we really look to other stakeholders to join us, because agencies like UNICEF, we rely on voluntary contributions, and every contribution you make really affects the lives of children.
Yeah, Dr. Yasmin, thank you. In fact, thank you for doing so much that you've been doing and with UNICEF all these years. Just can you tell us a little bit specific about what you're doing right now for children in this pandemic? And for example, when people donate, what will it be spent on?
Right. So a big part of our work is really supporting the frontline warriors, whether they're ASHA workers, Anganwadi workers, or school teachers or sanitation workers, who are spreading the message, who are communicating with all the communities to remind them of the very simple measures to prevent COVID, which means wearing your mask, maintaining your hand and your respiratory hygiene, and not going into crowded places. So we have reached over 650 million people with these messages. We've also worked very closely with, of course, the Ministry of Education at the national level and in the states to see children get access to remote learning. And we estimate that we've reached about 41 million children in this effort. We also know that as the services have reopened and the way we have worked with our counterparts and partners, around 20 million children have had access to some essential services that are needed to keep them healthy and to prevent malnutrition. And of course, malnutrition is an existing problem. So a lot of our effort is going into supporting children with malnutrition to be identified and that they receive the type of services that are needed. So those are some of the ways, including getting equipment for lab testing, for oxygen concentrators, for hospitals, by getting reagents that were needed in the early days to do the testing, and importantly, focusing on the psychosocial support care for children themselves, for their families, and for our frontline warriors.